10 years ago now. I worked for M&T Bank for 25 years. I had a great career with that bank, but my life took a very different turn about actually 12 years ago when my son was diagnosed with the disease of addiction. And I did not understand what was happening in the beginning because my son also has a medical condition. He has a condition called neurofibromatosis, and he has inoperable tumors in his brain. And he was diagnosed at 2 years old. By the time he was 7, he had his first brain surgery. And over the course of the next 7 years, he had 7 brains, or the next 4 years, he had 7 brain surgeries. Um, that was tragic in itself that we had to deal with that. But by the time he was 13 years old, we were in a stable place with that, and we thought that the worst was over. The coming years, I could never have been prepared for what happened next. We started to see behavior changes in Chris, and they weren't anything that popped out as unusual. They were, what a lot of parents might perceive as growing pains. He had a change of friends. He became more isolated, didn't want to spend as much time with us. But the behavior changes started to become more aggressive. And my immediate thought was the tumors, right? He has 2 inoperable tumors in his brain. They had to be creating some type of a problem. And I reached out to specialists. And over the course of the next 3 years, my son was diagnosed as schizophrenic, bipolar, psychotic, borderline personality disorders. Every diagnosis came with another prescription. And by the time that Chris was 19 years old, he had overdosed twice and tried to take his own life. And still nobody was talking about addiction. And it was by the grace of God that he got into a program at Horizon Health Services. And that program not only changed his life, but it changed mine as well. It helped me to understand this disease on a level that you can't even imagine. And in today's world, with being the worst epidemic in history, inside the worst epidemic in history, we are facing challenges that we have never seen before. I want to tell you what I've learned over the last several years, because when my son was diagnosed with this deadly disease, I wanted to do everything I could to best support him. And I'm going to tell you that if you are a parent, if you have children, if you have little brothers and sisters, nobody in this world is safe. This epidemic did not start because people started to just abuse these substances. My son was introduced to opioids through the brain surgeries and through the medications he received after. Addiction ran in my family. There was a boatload of influences that we didn't even really look at. There was a history of addiction in my family. He was introduced these medications on an adolescent brain. Things set up just perfectly that by the time he got into high school, even succumbing to simple peer pressures, his brain had already been triggered. And he will tell you in his own words, he went from 0 to 100 in about 30 seconds. Things we know today that we did not know 10 years ago. We know that adolescents who are given opiate narcotics for very legitimate reasons during the developmental years are at a 33% higher risk for developing an addiction to opioids later in life. Yet we continue to prescribe these very powerful medications for tooth extractions, lower back pain, sprained ankles, sprained wrists. We give them to kids. I know that Avi Israel spoke for you guys a few weeks ago from Save the Michaels of the World. And I started my journey with Avi. I was vice president of Save the Michaels. And that man is a true champion in our communities. He made change where no one else could make change. When I started this journey 12 years ago with my son, you couldn't get into treatment. You couldn't even find treatment. You could look in the phone book, you could call people. Treatment was not really available back then. And it wasn't because it wasn't there. It was because at that time, you had to fail at one level of care before you could get to the next, I testified with Ave in Washington, for iStop, and I'm sure he told you all about iStop, where the regulations went through to reclassify hydrocodone from a Schedule III drug to a Schedule II. That meant that those narcotics were not readily available in the community the way that they had been in the past. But that only sparked on the heroin epidemic, because those drugs like Oxycontin, Lortab, Vicodin, Percocet, Dilaudid, they're all synthetic forms of heroin. And when iStop regulation went into effect and kind of impacted the availability of those drugs, people for 20 years who have been prescribed those drugs, they weren't just going to stop. It was almost impossible for them to stop. So they turned to the readily available street drugs. It has created the worst epidemic in US history. Treatment facilities that were filled with 30 to 50-year-old alcoholics 30 years ago are now filled with 12 to 25-year-old opiate addicts. Almost 90% of them start with a prescription drug that's given to them by a friend or by a doctor. And recovery for this young adult population looks far different than we have ever seen before. You have so many influences that occur. You have the alcohol, which is no longer 3 to 5% alcohol by volume. It's 10 to 17%. It's designed with fancy labels to draw the young adult population in, and it's more potent. You have marijuana, which is no longer just marijuana. Kids are dabbing. They're using synthetics in their dab devices. Synthetic marijuana, not only the dangers and the results that we're seeing medically, but it's 50 to 60 times more potent than marijuana that people were smoking 30 years ago. These substances are making our young adults more vulnerable to bad decision making. And heroin is floating around our schools like pencils and paper. It's everywhere. Prescription drugs. You have Xanax. These prescription drugs are so widely abused. This is what treatment providers are seeing today in our treatment facilities, is the onset. We have an increase in treatment admissions for all these prescription drugs and the non-illegal substances that people are buying online. Kratom. People are buying Kratom online to address their withdrawal needs, and we're seeing admissions increase for that. So what we try to do in my position with Horizon is help families understand the importance of early intervention. And prevention has always been around, but I cannot express how much it is so important to intervene early with substance use, no matter what you think it is, because once that cycle starts, we no longer have the ability to make somebody stop. Not a parent, not a judge. Nobody has the ability to make somebody stop. We can get in between them and the drugs. We can learn how to hold them accountable. We can assess accountability. But without that, the disease continues to progress. And like cancer, it is a fatal disease. It's a progressive fatal disease. Early stage intervention gives people their best chance at recovery, just like early intervention with cancer. And make no mistake that addiction is a disease, like diabetes, like cancer. It's a progressive relapsing disease. People will find no cure from this disease, but they can find remission, and remission is tough. I want you guys to think about, just look through your family line, your genetics, your history. If you see any addiction in your family at all, whether it's drugs, alcohol, shopping, any type of addiction, I want you to know that it's in your lines. So that's the first risk factor that you are all going to experience with your families. Social access is going to be another one. Not talking to your children about drugs and alcohol is going to be another one. They're going to hear the conversations out in the community. We have the ability to slow down the progression of a fatal disease. We can't stop it. So you do that with accountability. And often as parents, caregivers, our hearts get in the way of making the decisions that are very difficult to make when it comes to supporting somebody who struggles with this horrific disease. And I talk to parents about this every day. It's not different from one person to the next. If the disease progresses, the outcome is likely going to be the same. No matter who it is, there will be negative consequences, if not jail, institutions, or death. So the sooner that we can intervene, the more opportunity we have to slow down the progression of a deadly disease. So think about in your family history, an adult who struggles with alcoholism. How hard it is having a family, a job, a career, children, how hard it is to put down the alcohol, even when all those consequences play a big, important role. And still they struggle. And then I want you to turn that around and think of the 12 to 20-year-old adolescent who hasn't even experienced life yet, who has no consequences, and is experimenting with a deadly drug that makes them feel good. How do we make somebody stop? It's the consequences that change people. So my son went into his first program at 19 years old. By that time, he'd already overdosed twice and tried to take his own life. He did not go willingly. He went fighting, kicking, and screaming, but he went. I had to do some things during that time that felt totally against what a mother should do. But I had come to the realization that if nothing changed, nothing was going to change. And my son was incapable of change, so it was up to me to make that change. And I had sleepless nights. It was a horrible, horrible time in my life. I didn't know if my son could make it, but I kept telling myself that if nothing changed, nothing was going to change. And he was just going to continue to progress in this disease and he would die. Or he would progress to the point and I would die and there would be nobody there to help him if he wanted to choose recovery. So he went into his first program. We would not let him come home. After his program, he spent 6 months at Horizon Village. I learned so much in that program that I approached the CEO of the company and asked her to create this position for me that I do now, because I felt they did a wonderful job once people got into treatment, but who was helping families that could not find their way to these treatment programs? Who was out helping people in the community? And they did. They created this position for me. I've been in it for 8 years. I've helped thousands of families navigate their paths to treatment and services, provided support for them in the most crucial moments of crisis, explained to them what some of the barriers are for people getting treatment. My son graduated that program after 6 months and he went into a halfway house. He was just under 20. He spent 4 months in a halfway house and he relapsed. The difference that I saw in my son at that point was that he had just experienced 9 months, 10 months of recovery. He felt empowered about what he had accomplished and he did not want to go back to the drug use. And he called me and he asked me to help him. And that was on a Saturday. By Monday, he was back in a program and he spent another 6 months at Horizon Village. From there, he went into supportive living for 3.5 years. The first 5 years of my son's recovery was spent in treatment programs at one level or another. Those treatment programs saved his life. They had the ability to get in between him and the drugs. It did not stop his drug use, because that only he could do. And he had to learn how to do that. Remember, we're dealing with an adolescent brain. We're dealing with a brain that knows nothing but what he's been doing for the last few years. He had ups and downs, but every time he had a down, there was accountability. There was somebody to hold him accountable. He was surrounded by a tremendous support system. 5 years he spent in programs. Each year got a little bit better, but it wasn't until he was about 26 years old that he finally said, I'm done with this. I don't want to do this anymore. My friends have graduated from college, they're getting married, people are going on, and I'm still in and out of treatment programs. If it was that easy, everybody would be better, right? It's still a struggle. My son today is 30 years old. He's graduated from college on the dean's list. He has a great job with the state. He is doing amazing, but he is not better. He will never, ever be better. But he is surrounded by a support system that, I'm sorry, did somebody have a question? Nope. He's surrounded by a support system that can recognize when he is struggling. We can recognize when he's hitting bumps in the road. He still is engaged with a counselor. He still sees a mental health counselor. Life is pretty damn good today, but I don't for 1 second kid myself that we are out of danger. Things that you and I take for granted, things in life that we take for granted every day, you know, the loss of a job, the breakup of a relationship, the loss of a parent, they're all going to be triggering moments for somebody who struggles with addiction. And if people do not have good support systems in place and people who understand this, the likelihood of relapse is higher, right? It's not a necessity. People do not have to relapse. It's not a requirement of addiction. But if you think that it's not possible, you're doing your loved one an injustice, because the likelihood is very high. And we have to stop looking at relapse as a moral failing and start looking at it as an opportunity for stronger recovery. Because every time my son hit a bump in the road, he got up a stronger person, more resilient. What is missing from my recovery? What do I need? Why do I keep having these struggles? And that was a journey only he could take. I could tell him till I was blue in the face that, you know, it's not a good idea, but I couldn't live his life for him. And addiction is a very, very lonely world. Those of you who are familiar with it know that in order for recovery to really happen, you need to change people, places, and things, right? How hard is that for a kid? Goes to school with all the same friends, has a problem with substance use, we take them out, we put them into a treatment program, and then we put them right back into the same school. You know, they have challenges that we have never seen before. And the reality is, for the young adult population, we really don't know what true recovery looks like, because we have not been in this epidemic long enough to see long-term recovery. I deal with thousands of families today, and I can tell you what works. And it's education, having families educated to learn how to best support them, to navigate them, to hold them accountable, to not think with your heart, but think with your brain, to utilize the services that are available so you're not making rash decisions. You weigh and measure the pros and the cons of every decision that you make, to guide them through treatment and services with positive reinforcement and healthy motivation, not make them feel horrible about the disease they have. Nobody feels worse about that than the individual themselves. Yet as family members, we often let it get to such a terrible place that the dynamic in a family has broke down. There's no communication, there's no talking. People are angry, they're mad, parents are afraid their children are going to die, and the dynamic is horrible. We can all do a better job at spreading the word and not making people feel that the word addiction is a dirty word. It's not. It's a disease, like diabetic. It is a disease of the brain. And the hardest part for people is that it's invisible and you can't see it. And the outcome of it can be really horrible. Families are torn apart, they're ripped apart. We work very hard at Horizon to engage families in counseling and supportive services. We know that to heal an individual, the whole family needs to heal, the whole support system needs to heal. We want that engagement. We are facing very challenging times right now with the COVID epidemic, and it is kind of put at crunch on all the support services that we had available to navigate loved ones to treatment doors, which more than ever now, we need families to understand the importance of healthy involvement, getting educated, learning about the services that are available, learning about medically assisted treatment, helping their loved ones get into treatment programs that can provide stability. Treatment programs do not make people better. That's not the objective of them. Treatment programs stabilize people. They stabilize people so that they can think with a clear mind from a good place and be able to make rational decisions about their recovery. 90% of families that I work with, their loved ones go into treatment resistantly. They don't go because they want to get better, because remember, we're dealing with a drug that they like the way it makes them feel. We see the consequences of that use before they do. And often, again, as parents, we get in the way of those consequences coming through. You know, we wake our loved ones up for work to make sure they get to work on time. We pay their bills. We give them money for rent. We pay for their attorneys. We do everything out of love that enables the behavior to continue. And until we start to change that, nothing's going to change. Again, it's change follows change. But we need families to understand that they need to get involved. We need their help to help navigate people to these treatment services, because it's in those moments of clarity that change can happen. If people just continue to use, they just continue to stay in that mode of active addiction, the only thing that's accomplished is the disease progressing. And what was once seen as end-stage addiction in 60-year-old alcoholics is now seen in 25-year-old prescription drug and opiate addicts. End of life at 25 years old. No parent should have to bury their child, and especially not to this disease, because it is preventable. But we don't like to talk about it. We don't even like to believe that it could happen in our family. But it can. It can happen in any family. Again, look at the risk factors in your family and determine if you're at a higher risk. If you are, you need to be right on top of things, because this is very prevalent in all schools. Grade schools, high schools, colleges, prescription drugs float around your communities like pencils and papers, and they have opened the door to one of the worst epidemics in history. And just because your child is maybe only drinking or smoking marijuana doesn't put them at lesser risk. We need to get rid of that old mentality thought that I did it and look at me, I'm fine. It's a changed world. Kids have not changed. They are all going to make bad choices just like you and I did. Those influences are going to pop up. And without the education that they need to make good choices, they're likely going to fall prey. And we don't educate enough because we're afraid to talk to our kids. We feel like we're putting suggestions in their head. We're not. We need to educate about the dangers of what is going on out there, because it's not kids that have changed, it's the world that they are living in. And again, early intervention, even if you have to do it over and over again. My son was in 8 different programs in a 5-year period. Every time he was in a program, it took away his ability to use so freely, and there was clarity. There was time for him to think about what he was giving up in life, what he was losing, what he was risking. It was an ability for him to see everybody else around him was moving forward except for him. I prayed that in one of those moments, something would change in him, that he would want recovery, that he would value it. And I held on long enough till that moment came, and he did. He chose recovery. And now today, he works harder at his recovery than I do. It wasn't always like that. It was me doing the majority of the work, me pushing him into programs, me taking him to his appointments, me communicating with the counselors. But over time, the table started to flip and he started to value it more. And today he's pretty successful, but again, he's always going to face challenges in life. His life looks different than most of yours. And he's grown to accept that. It doesn't make it easy for him. Sometimes he's very lonely, but he accepts that he is going to face challenges in his world, and he needs to make sure he doesn't put himself in environments that are going to be toxic for him. And if you guys think about that, that doesn't leave too much left over, right? Football games, parties, social gatherings, Christmas parties. People are drinking and having a good time. It's not about the individual. My son does not want to risk his sobriety. It's about the brain. And he would walk into a place with the best of intentions. I'm not going to do this. I'm not going to do this. I'm not going to do this. And as soon as he walked into that environment where people were drinking and smoking and the activity, it was the brain that started to fire. Not him wanting it, the brain that started to fire. And he had all of about 6 seconds to be able to control that trigger. As time has gone on, he's become stronger and he's able to do that more. But think about a young kid. Think about a young kid that just wants to be with his friends. Just, I'm not going to use drugs. I'm not going to do this. I got this. I know what I'm doing. But walks into that environment where all his friends are partying and having a good time. Do you really think that they're able to not do it? It's about the brain. So we really need to encourage families to get support, to get educated. Don't be afraid. I run a parent and family support group that meets twice a month. Right now it's meeting online, it's a Zoom. But I'm going to tell you, the attendance through Zoom is even better than it was in person. And it was good in person. Families are afraid to broach this subject because it's hard to hear. It's hard to hear what life might look like, because the only things that we want for our children and our loved ones moving forward are health and happiness. That's it, right? That combination, health and happiness. And if you don't have both things, life looks different and you need to figure out a way to work around it. And it's hard for families to hear because nobody wants to think that their loved one is going to struggle with either one of those things for their entire life. But life can look good. And for me, as a parent, I take precautions. We're 5 years in recovery, but I still keep Narcan in my house. I encourage everybody to have Narcan because as a parent, as a support, as a friend, you don't see it coming. My son did not exhibit behaviors, not like if he was drunk or even high. Opioid addiction does not present like anything we have ever seen before. People can function academically, scholastically, and employment for long periods of time. And a lot of these medications are prescribed, and people who are prescribed them often become addicted to them. Narcan should be in every medicine cabinet in America. That's my personal opinion. There have been too many lives lost. In this environment that we're in now, there are so many challenges that we're facing. We have over a 400% increase in accidental overdose deaths since COVID-19 started. Families that I have worked with for many years whose loved ones were doing well, but you add all these factors in of isolation, boredom, the money in their pockets that they're getting from the government. These are all recipes for disaster. And the services were impacted because they couldn't do face-to-face. So people who have loved ones who are struggling with addiction right now are really facing challenging times. And if you know and care about anybody in that situation, reach out. Reach out to them and just ask if there's anything you can do. Can you link them up? Tell them about my meetings that I host online. My phone is always on. I always try and answer my phone. I don't turn it off. As a parent, I know that crisis doesn't happen 9 to 5. And often family members are in crisis at 7, 8, 9 o'clock at night and just need to talk to somebody. Encourage families to have Narcan in their house, even if they think it's not opioids, because you don't know. And encourage them to get support themselves. The stronger they become, the more apt they are to change, and their change will produce their loved ones' change. So is there anything, Miranda, that you wanted me to touch on that I didn't? I can talk a little bit about what treatment is looking like right now.
Yeah, that would be great because I know in a lot of the past presentations, given the COVID-19 pandemic, obviously that's affecting treatment and it's obviously affecting the
Right.
opioid epidemic. So if you could touch on that, that would be wonderful.
Okay, sure. So, as a treatment provider, I work for Horizon, but I work with all treatment providers in the Western New York and Pennsylvania area. So I can do a referral anywhere. I mean, often people will be linked with outpatient treatment and will get a recommendation for a higher level of care, but often they are not linked with any form of treatment and need detox immediately, or an inpatient, or they just get to a point where they say they want a higher level of care. I can refer to all those agencies. So all it takes with me is a phone call. All agencies are continuing to accept patients in this environment in inpatient programs. We all are across Western New York. There are some changes that have to be met, COVID-19 requirements, but nobody will really be turned away. They just, we just need to make sure that they're stable enough to come into a program. As far as outpatient programs, outpatient has been more virtual. They're just starting within the next week to do face-to-face more often with the higher risk cases. Obviously, if somebody's doing well and has some time under their belt in recovery, we don't necessarily need to see them face-to-face. But with your high-risk patients, we have lost the ability over the last several months to hold them accountable because you can't drug test them. I work in the treatment court. I work in Lancaster Treatment Court. Treatment courts are amazing programs. And I'm going to tell every one of you, if you're ever in a situation where somebody is eligible for a treatment court, do not be afraid of them. They have the ability to hold somebody accountable where a parent or a husband or a wife or a support may not. They may not have that ability. And treatment courts can be pretty amazing. My son was in a treatment court in the first 3 years, and it just gave us additional leverage to keep him connected to treatment and services. And if that wouldn't have happened, I don't know where he would be today. Unfortunately, with COVID-19, treatment courts also have lost a little bit of their ability to hold people accountable. So again, we're in an environment right now where we are facing challenges from every alternative. If somebody is willing to go into treatment, the resources are there. But if they're not willing, we have lost quite a bit of ability to force somebody to go into treatment. And a judge used to be able to do that. Clearly, a jail cell motivates people quite easily. And treatment providers have been able to motivate people to go into treatment. But without that face-to-face contact, it has really made things tough for us. The form of motivation that we rely on most right now is family. Family trying to motivate their loved one to choose a better path, to take the path to recovery. Medically assisted treatment has been available right along. But I won't go into a whole lot of detail about medically assisted treatment, but there are various forms of it. There's Suboxone, there's Subutex, there's Vivitrol, there's Methadone, and most recently we came out with Sublocade, which is a shot under the skin. It's a Suboxone under the skin. So it alleviates a lot of the room for diversion, which is a big issue with youth and Suboxone. You usually can get somebody into a Suboxone program within 24 to 48 hours. So that is always available. And ECMC, our go-to for crisis, has been amazing with linking people to the next level of care if they are unable to keep them in their program there. So over the last several years, I want to tell you that when I started this journey 12 years ago, it was like trying to find a needle in a haystack. Today, agencies have all come together. Treatment providers, prevention providers, law enforcement, hospitals, drug courts, they all work together on the best solution. And I'm part of the opioid task force. They have done an amazing job in Western New York to keep the community informed and to document what is happening here. The opioid overdose prevention program in Erie County is the best reported program in all of the state. And it has opened us up to additional funding. It has allowed us to add 125 beds in Western New York in the last 4 years. So there's a lot of changes going on to meet the needs of what is happening. We just need to openly talk about this more to help families understand the importance of early intervention and navigating their loved ones towards treatment. If somebody connects early, they're much more apt to accept care. Continuation of care has a way of life, right? We do it for diabetes. You don't see your diabetic doctor once and then never go back again. You continue that care with them throughout your life to make sure you manage your disease. Same thing with addiction. We need to continue that care to manage that disease for the best chance at long-term recovery. Thank you, guys. I think we could open it up to questions now.
Okay, perfect. Yeah, thank you. And thank you for adding that point on continuation of care, because I think that's incredibly important and honestly not talked about enough, nearly enough. Because I think there's this criminalization and there's this stigmatization of addiction and what it is. And so thank you for bringing that up and touching on that.
Absolutely.
So incredible.
I just want to say with my son, we always took that approach. We never wanted him to be ashamed of his disease. We wanted him to accept it as a disease, but be proud that he chose recovery. And that's what we focused on. He was part of the Blue Cross and Blue Shield awareness campaign with Avi Israel in the early years. Both he and Michael were featured on billboards in Buffalo under the Tragedy and Hope campaign. And, there is hope. And I do believe that a lot of what Chris did in the early years motivated him to want to choose recovery.
Yeah. Well, thank you so much. Please, if you have questions, everyone, please just type them in the chat and we can get started with the Q&A section.
Thanks.
Colleen, do you think we could share your information and your program information with everybody that attended today?
Absolutely.
Great.
That would be great.
Awesome. Thank you.
We have a question here. Are these services all accessible outside of referrals?
Yes. So like I had mentioned earlier, and I will give you my phone number. My phone is always on. You do not have to be a Horizon client to access my services. There is no charge, so you don't need to have insurance. I help people navigate the path to what they need to get services. And I really haven't had anybody who's not eligible for them, but it might look different for certain clients. But if for some reason we need, my caseload is quite large, but it's not a typical caseload. And there might be families that I deal with over extended periods of time because they're just looking for that support to help their loved one navigate those services. So it's more the families that I deal with. Typically by the time that the client calls me, they're ready.
I have another question here. What does Horizon do in terms of Narcan training and harms reduction for families and support systems?
So I am a Narcan trainer. I do a lot of their Narcan trainings. We train everybody in our community before they leave Horizon, gets trained in Narcan recognition and kits. If you are looking to do, a training outside, like I said, I could do it. You could arrange it with me and we could do this same format. If you are looking to have someone else do it, you can contact Christina Pearl, who is our communications director, and she would set up to have Narcan training. My training is a little bit, it's not the standard, black and white Narcan training. It is a weave in and out of my personal story and the Narcan training. I just feel that connection that people have to why I feel Narcan is so important. I mean, my son was Narcan altogether 4 times. He's 1 semester away from his degree in psychology today. He might save somebody else's life. We don't have the right to judge who deserves Narcan and who doesn't, because nobody knows how that person got there. We have a moral obligation to do our part to help people overcome this epidemic and hope that they choose recovery. But not everybody does. I mean, that's been the case for a million years. We have a tool available that we all should be trained in because it helps people have a better understanding of what the individual is struggling with. Nobody wants to live handcuffed to a substance. We need to help challenge them and motivate them to work towards a different way of life. So again, I can give you all that information for Horizon. Do you want me to say it now so you can write it down, or you want me to send you something?
Yeah, you can send it to me and then I can send it in an email to everybody on the call. So thank you though, because
okay,
it's really important and very helpful. Oh, awesome, Will. I don't know if you see that. Will said that,
yep,
changes are happening. 300 people Narcan trained and Narcan given from Erie County Department of Health. Yeah, that's awesome. And it really is.
It is awesome.
Like you said, I mean, who is anybody to judge who deserves Narcan and who doesn't? We don't have that right to determine that. So we can do our part to, distribute that Narcan and, help it save a life. And it's so important.
Right. I'm going to share a story with you. I actually started training in Narcan before I worked for Horizon because I was so passionate about the message, and Horizon trained me and let me go out into the community. And I went to police agencies and I got a lot of resistance from the police agencies, but this one particular police agency allowed me to come in and I trained all their officers, and there was a lot of snide remarks, and it just was not a pleasant experience. But after I shared my story, it was there was a change in the attitude. But a year later, one of the officers from that training came up to me in the drug court that I work in and said, it was his brother. I have to thank you for that training. I was able to save my brother's life. I never had a clear understanding of the disease until now. And you never know who you are impacting when you talk about this, because this disease doesn't discriminate. Mm-hmm. It doesn't pick and choose who it's going to attack. It doesn't have to be abuse. People become addicted because they need those medications for legitimate reasons. So I just encourage everybody to get as much education as you can and be proactive instead of reactive, because it's an epidemic and it hits closer to home than many people think.
Mm-hmm. Exactly.
I would be interested in if anybody has any comments on what they learned here today. if they learned anything.
I think if people want to, they can unmute themselves as well.
Oh, there's a comment here from Diana. The amount of effort for your son to finally get help.
Diana, unmute yourself. I'm not sure what you mean by that.
Sorry, I had to look for the unmute button. I just know you asked for things that we learned, and I learned the amount of effort that it took your son and you, your family, to finally get help, how many steps you had to take and places
Right.
and people. And that was what I learned. I mean, I knew that was out there. I heard of that, like with anorexia and some other things, but it was unbelievable by the time you got the right help. That's what
Yeah, it's
a million other things. It was a great talk.
Thank you. But that's a good point that you bring up, Diana, because, you know, myself included as a parent, I think part of me wanted to believe it was mental health and didn't want to look at the substance use part. So the providers that I reached out to were not substance use providers. They were counselors that specialized in mental health. So he was diagnosed as schizophrenic, bipolar, psychotic, borderline personality disorders. All the diagnosis came with another prescription, but nobody was talking about addiction. I knew something wasn't right as we went through the journey. I could see, you know, I would find things around, and I knew the substance use had started to progress, but I did not realize that he had progressed to heroin. And the one thing that I learned through this journey very early on is if you have the slightest inclination that it is substance use, of course it's going to present mental health issues. You have to treat the substance use before you can get to the mental health. If you try to treat the substance use or the mental health first, you're going to end up exactly where I did. So it's really important to choose a provider. And there's a lot of programs out there now that are integrated care. They treat both mental health and substance use at the same time. It's really important to do that because otherwise you could just be, you know, contributing to an already growing addiction problem by trying to treat mental health that is created by the addiction.
Very interesting. Thank you.
Will, thank you for your comment. Different point of view, seeing addiction disease developing at younger ages. I think many people focus on people that are homeless or have any other burden to society and have addiction rather than how it happens to people and how people become addicted.
Right. Well, I can tell you that the opiate epidemic, the prescription drug epidemic, has definitely changed the face of addiction. Again, treatment programs that used to be filled with, you know, 50 to 60-year-old alcoholics are now filled with 12 to 25-year-old prescription drug opiate addicts. It is a massive epidemic, and it has taken on a new face, the face of an adolescent. It's made things very challenging in today's world. So again, you don't have to abuse drugs to end up in this position. You need to be very aware of what you're being prescribed, because kids still get Loratabs, synthetic forms of heroin, for tooth extractions. For your kid gets hurt on the sports field, they might be given Oxycontin or hydrocodone, synthetic forms of heroin. If addiction runs in your family, if you can see addiction in your family, you are at a 50% higher risk of your child developing an addiction in as little as 1 or 2 times. You know, there's 20%, or there's a part of the population that will take those medications as prescribed a couple days to get through breakthrough pain, and they'll put them down. There is a part of the population that will take those medications and get sick. It'll upset their stomach, they'll be sick, they can't take them. And there is 20% of the population that will take those medications and say, I like how this makes me feel. If that part of the population acts on that impulse and takes those medications not as prescribed, starts to abuse them, there is a very strong likelihood that they will end up addicted. Nobody knows what part of the population they're going to fall into until after the fact. So as a parent, we need to know this. I can look back now and tell you that my son liked those medications. When he was in the hospital after those brain surgeries, he liked how they made him feel. And as a parent, you know, they act all goofy and they're saying stupid things. I look back now and I'm like, oh my God, that should have been a red flag for me, but it wasn't, because I didn't know. Nobody was talking about these things back then.
Thank you, Will, for another comment. I think that's really important. As a college student, a lot of prescription use of young adults is ignored and not seen as a problem because it's become part of study culture, which is so true with Adderall, Oxycontin, Xanax, you know, and it's just seen as take this to get through your 12-hour study period or whatever it is. And again, it's developing an addiction to that. So thank you for
right. So true. And so, Will, you are so spot on, because that's what we see. And treatment admissions have skyrocketed.
Yeah. Anybody else with comments, questions, please unmute yourself. Please put them in the chat. Don't be shy.
Don't be shy.
Yes, that's so true. Will is hitting on all the points. Yeah, he really is.
So, are all the students here from UB?
Well, I know Will is. I know I'm.
I'm very affiliated with Buff State. I do Narcan trainings there every month. I do them now. I'm doing them over the internet. But if anybody is interested in that and they go to Buff State, they can always check with their wellness department there for the dates.
Well, if that is it, if nobody has any other questions or comments or anything, I just want to say thank you so much, Colleen, for sharing your story and all this wonderful information. It is so, so important that we talk about these things and hearing from, you know, someone who has lived through these things and is now, you know, taking your experience and really changing it into this helpful, you know, treatment center and really helping people who have gone through things that you and your son have gone through is so important. So thank you so much for the work that you do at Horizon. And thank you so much for sharing your story and spending time with us this afternoon. And thank you all for attending this session today. We really appreciate your support. I want to remind everybody
Thank you, everyone.
Yeah, thank you so much. We'll be back here next week for, sadly, our last session in the Opioid Education webinar series. We have Dr. Sarah Sarcone-Heavey, who will be presenting actually on Narcan awareness. So if you're interested, please tune in same time next week, Wednesday at noon. But thank you so, so much, Colleen, and thank you all for attending today.
Thanks again. I will send you that information, Miranda and Brittany. You guys have a great day.
Thank you so much. You as well. Take care, everyone.
Bye-bye.
Yeah, have a good one.
Bye.